Now, the Eastern Cape Health Services has been in sharp focus this week as the province battles rising COVID-19 infections. The Health Minister, Dr. Zweli Mkhize, is in the province on a 2-day visit to assess its efforts to contain the spread. Meanwhile, the Treatment Action Campaign in Nelson Mandela Bay has called for the unfreezing of healthcare worker posts. Joining us now to explain their position further is Anele Yawa, the General Secretary of the Treatment Action Campaign in Nelson Mandela Bay. Anele, good afternoon. Thank you for joining us today on the Newsfeed PM. As we speak, the Minister is visiting the province for the second time for fear of a second wave, and he's there to manage the intervention from the province's side. However, you have been saying that what we are seeing with COVID-19 is something that you had raised even 5 years ago about the health system in the province. Is the system dysfunctional and on the verge of collapse?
Good day to you and the viewers at home. I am the General Secretary of TAC National. What is happening in Eastern Cape, as you have alluded, is not something new. It's something that we have alarmed the Department of Health in the Eastern Cape about what needs to be done as a matter of urgency. Unfortunately, our call fell into this year, and as a result of that, even when the Nelson Mandela Metro and the Eastern Cape was all over the news, we came to Nelson Mandela Metro, we met with district management, we met with the Eastern Cape provincial management when Dr. Mbendashe was still the DG. We raised a couple of issues of what needs to be done. So in Nelson Mandela Metro and other parts of the Eastern Cape, there are a lot of challenges, starting from the infrastructure, going to human resource issues, going to issues of the ambulances, going to the issues of the availability of medicines, going to the issues of staff attitude towards the patient. But amongst them all, we were alarmed by the number of healthcare workers who succumbed to COVID-19 in the Nelson Mandela Metro, and the fact that up until today, those healthcare workers who died in their positions, nobody has been hired now, which makes it more worse and more burden on the shoulders of the healthcare workers who are currently functioning. We are also worried about what is happening with regard to the employment of the communal care workers, because we strongly believe that communal care workers are foot soldiers and the backbone of the health system. And if you don't pay attention to health to communal care workers, it means whatever effort that the government is trying to make in terms of improving the quality of care services, without them, it will be just like a waste of time, because it is the same communal care workers who are deployed in our communities to do the outreach, to trace people who are contact, and also to do screening. But what worries us is that their working conditions are not taken into consideration.
So, Anele, you're saying the visit by the minister, his presence there, the presence of the resurgence team of specialists that has been deployed there, but we also got Cuban doctors who have come to South Africa. They've also been deployed to the Eastern Cape to help with the response to COVID-19. You're saying all these efforts and all these interventions will literally come to naught at this particular point. You have no confidence in that response.
Not exactly. Like, one of the things that I want to mention here is that as TAC national leadership, we've got a scheduled meeting with the Minister of Health next week, Monday, where, among other things, we'll be discussing about the issues of Nelson Mandela Metro, the issues of Eastern Cape, and see how best we, as TAC and other community-based organizations, we can come to the party in terms of assisting whatever effort our government is trying to implement. But it will be a futile exercise if we're going to make proposals and suggestions on what needs to be done and no action is taken with regards to that. But on top of that, one of the things we wish to bring to the attention of the minister is for the minister to talk to the MEC of Health. The MEC of Health in Eastern Cape bought scooter bikes instead of buying ambulances. We believe that across Eastern Cape, there are a lot of ambulances that are parked outside the Department of Health buildings. And most of these ambulances They don't have major problems. All what they need to do is to fix them. So one of the calls we want to make forward is to say the MEC must return those scooter bikes, take that money, use that money in terms of fixing the ambulances that are parked outside the buildings of the Department of Health in order for services to be able to adequately reach to the needy communities. But on top of that, I think the Eastern Cape MEC of Health must come to the part. It can't be true that the Minister of Health is the one reaching to civil society organizations like TAC and the MEC is not doing anything about that. We need to meet with the MEC, we need to engage because as TAC with the Nelson Mandela Metro management team, we visited some facilities in the month of August and September, and we were able to make some recommendations on what needs to be done because one of the problems that we have experienced is a situation whereby we have noticed that most of the clinics gates were closed, people were forced to wait outside, there was no social distancing observed, no one outside those clinics was ensuring that people are wearing masks, people are sanitized, social distancing is observed. But on top of that, in that process, many people defaulted on HIV and TB treatment and other chronic illnesses. But in the same breath, many people in that process of handing over their medical files over a fence, people were given wrong medication and there were a lot of human rights violations which took place in that era. So if we want to turn around the situation, how do we make sure that we do away with the wrong practices that were practiced during level 4 to level 1 lockdown? But on top of that, there are a lot of people in Nelson Mandela Metro and in the Eastern Cape who are lost on follow-up, both on TB and HIV treatment. How best can we work together to trace those people and link them back to care? But if what chases these people from accessing healthcare services in these clinics is not addressed, it means those people again will go away from those clinics. So our approach is going to be two-pronged: trace and link back to care those who have defaulted, but also fix the problems that have been identified inside those facilities.
Anele, looking ahead, speaking of HIV treatment, the World AIDS Day on Tuesday next week, the way in which the pandemic has been handled and the response that we've been having towards HIV and AIDS in the country, is there something that you're picking up from how we've responded? Are there lessons that we can learn from there that we need to apply in our approach to the treatment of HIV and AIDS?
Yes. Firstly, if we can compare the intervention of the state and everybody to HIV versus to COVID, the intervention of our state on COVID was too militarized and it was centralized around the politicians. There was no involvement of civil society and communities like the same way we did in our response to HIV. But on top of that, we have witnessed a number of facilities that we have visited in Nelson Mandela Metro and in other parts in the Eastern Cape, where other services like your HIV, your TB, and your chronic illnesses were suspended, and COVID-19 was made a priority. It is against that reason we are calling for the integration of services for HIV, TB, and COVID-19. But on top of that, if you can compare the number of people who contracted tuberculosis in the country and people who died of tuberculosis as compared to COVID-19, you will see that there is an imbalance in terms of the numbers. According to the World Health Organization report, in 2019 only, it is estimated that about 301,000 people contracted tuberculosis in South Africa. Between 60 to 63,000 people died of tuberculosis, and 40,000 of those people are people living with HIV. So it is against that reason we are calling upon the president of the country, Mr. Ramaphosa, the deputy president, and all stakeholders to declare tuberculosis as the public health emergency. We would love to see the minister doing on TB response the same thing that the government is doing on response to COVID-19, where the minister is able to give the country statistics of people who contracted COVID, people who died of COVID, and people who have recovered on COVID. We don't see the same happening on tuberculosis.
Yeah.
It can be true that one illness will be treated as a priority over the other. So we're calling for an integration of services and an integration of a response. Lastly, we all know that the Minister of Finance early this year took some money from HIV conditional grants to respond on COVID-19. We will be glad if the Minister of Finance, the President, the Minister of Health can return back that money, that conditional grant on HIV back to HIV and TB services so that we can be able to continue to save the lives of the people.
Anele Yawa, appreciate your time, Secretary General of the Treatment Action Campaign nationally there.